Do4 is on the posterior midline, below the spinous process of L2. Do12 is on the posterior midline, below the spinous process of T3. Stomach 27 is on the lower abdomen, 3 cm superior to the pubic bone, level with Ren 5.
Gallbladder 12 is found just a few fen anterior and inferior to the extra point peaceful sleep. Do18 is on the posterior midline, halfway between Do20 and Do16. Do22 is located on the midline, 2 cm posterior to the anterior hairline. Use the 3 cm from the centre of the glabella to the anterior hairline to calculate the 2 cm that you need to find Do22. Extra point seal hall is on the anterior midline on the glabella, directly between the medial ends of the eyebrows.
So moving from large intestine 2 to large intestine 3, over the head of the second metacarpal joint into a significant depression. Again, the hand should be loosely flexed, so in a loose fist, and you should fall into that point. Large intestine 4, you're going to find the length of the second metacarpal bone, so running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Lung 9 is located on the lateral aspect of the wrist flexure, in between the radius, the scaphoid, which is one of the carpal bones, the radial artery, and the tendon of abductor pollicis longus, which is this big tendon that can pull the thumb out. So find the dip between all those three landmarks and the radial artery and mark your point there. To find lung 10, find the midpoint of the shaft of the first metacarpal and go in between that point and the muscle of the thenar eminence.
Lung 11, it's at the radial nail point of the thumb. So in order to find that point, I'm going to look at where the proximal and radial borders of the nail meet. I'm going to look at the nail bed, feel for where the flare of the bone is, and put my point in. Heart 5 is on the flexor aspect of the forearm. It's 1 sun proximal to heart 7, on the radial side of this flexor carpi ulnaris. Heart 7, which is at the flexor aspect of the wrist joint, at the proximal border of the pisiform bone, the radial to this flexor carpi ulnaris tendon. In order to bring this tendon into relief, if you get the patient to put their thumb and their little finger together, that will bring that tendon up. And just relax. Articulate the wrist and pop your point in. Pericardium 7 is on the flexor aspect of the wrist. It's level with heart 7 and between two tendons, palmaris longus and flexor carpi radialis. Some people don't have this palmaris longus tendon, in which case you'd just be going ulnar to this flexor carpi radialis. So finding heart 7, articulate the wrist, coming between those two tendons, that if you can't see them, you can get the person to join their thumb and their little finger together, and that will highlight those two tendons. And just relax again.
Sanjiao points on the forearm are best located with the arm laying flat on the bed and the elbow turned outwards. To find Sanjiao 5, come 2 sun proximal to Sanjiao 4, in between the radius and the ulna. You should be on the radial side of the tendon of extensor digitorum communis. If the person wiggles their fingers, this tendon will come into relief. Kidney 6 is located 1 sun directly inferior to the prominence of the medial malleolus. Palpate down 1 sun and feel for a cleft in between 2 tendons. Kidney 6 lies in that cleft. A common mistake is to palpate down only half a sun and to try to locate this point in the ankle joint. It's not in the ankle joint, it's in the cleft between the 2 tendons that are inferior to it. Liver 11 is located 2 sun directly inferior to stomach 30 on the medial border of the muscle adductor longus. Spleen 6 is located 3 sun superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. The easiest way to find spleen 9 is to palpate gently up the medial crest of the tibia until you fall into a nice depression formed by the medial crest of the tibia and the inferior border of the tibial condyle. This point's in a depression. It's not on bone, it's not on muscle, it's in a tender depression. Stomach 36 is located approximately 13 sun superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 sun inferior to the inferior border of the patella.